Thank you, dear colleagues, for the great presentations. And first of all, I would like to say that I totally agree with you that in reality we cannot achieve good rejuvenation results without complex methods, without combination of different kind methods and products together, and threads cannot work alone. But before I will follow about these questions, speaking about these questions, I would like to speak a little bit about history of Aptos, the story of going from the complex to the simple, which we started in 1987. My father, he is here, inventor of Aptos methods. He invented first devices, first methods and products for plastic surgeons to help them to reduce difficult operations, to reduce recovery periods for their patients, and to improve their methods. And it started in 1987. Already in 2000, doctors from all over the world started to use first and second generation Aptos threads in their practice. But in most cases it was again plastic surgeons, and it was again for the reducing of plastic surgery operations. In 2006, we invented a new product with absorbable material. It is polylactic and caprolactone acid together, and since that time a lot of dermatologists from different countries starting using thread lifting in their practice. And 2012, as Albina just told us, here in Monaco we presented a new product. It was, and it is right now, Excellence Visage. It was indicative time for us because it changed thread lifting. It changed the idea because it was not only for the lifting and rejuvenation effect, which is very easy to use in face, like Excellence Visage, but also Excellence Visage gave us a nice rejuvenation of the skin and soft tissues. And we have seen it. So Aptos has never been so close to the dermatology in that time when we invented Excellence Visage. And in reality, this is one of the best products in the thread lifting today on the market. This is a bestseller. Excellence Visage gave us possibility to invent more products for face rejuvenation, not only for the lifting effect, but also for skin rejuvenation, for skin reparation, armoring. That's why now we have different kind methods and threads exactly working for skin armoring. But today we are ready to make a next step from excellence to perfection. 2018. Before I will follow, I would like to say that today me, as well as some of our partners, received such present. Some of you are here, yes. Some of you are on live on Facebook, and I would like to open it together with you. Let's open it and let's see what is inside. I have this pack. Very nice. Let's see what is inside of this pack. Threads. Let's open. You do not need to open. It is sterile. You can use it on the patients. Don't damage it. I will show you. No, don't worry. Nice packing. Looks very nice, right? Let's open it. I have no patient today, but no problem. I have a lot of them. 10 threads, 10 cannulas. Threads are preloaded. Cannula for infiltration. Very easy to remove the thread out. very easy to use. Yes, very nice. But I still see that you have a question. What is it? Third revolution in the packing? Of course not. This is not important. Third revolution is here. So, what does mean? These two letters. Two letters are very important for us. Yes, colleagues, we did it. And now Aptos is hyaluronic acid included. We have a formula of success. We have polylactic acid, caprolactone, which is one of the best composition, and plus now we have hyaluronic acid included to our threads. So how we did it? Just a few words about it. We took one of the best products in thread lifting in the world, which is Excellence Visage. The thread that has multi-barbs, that means that it holds and fixes tissues very strong and give us a long-lasting lifting effect on the face of our patient. The thread, which is included and preloaded in round tip cannula, that means that it is very safe, only one entry point, no exits, no trauma, no hematomas, and shorten of rehabilitation period. The thread that give us possibility to correct different areas on the face with the different methods for the lifting effect, and not only lifting effect, but also sometimes creation of volume on the cheekbone area, for example, when we have possibility to reposit soft tissues in the needed position. So this is a universal product and universal method. And of course composition, which was and which is till today polylactic and caprolactone. And polylactic and caprolactone composition together gives us possibility to absorb thread during 2 years. Look on these slides. This is our research we did for FDA approval in USA, and it shows that during first 12 months, which is 1.5 years, threads absorbs for less than 50%. The rest 50% absorption we have after last 6 months, at the end of 2 years. So we expect, and we have with the practice, and we use these threads since 2012, results for 2 years of lifting effect on the face. So we took this perfect thread and add there hyaluronic acid. That gives us more extra, which is biocompatibility, anti-inflammatory reaction, collagen stimulation, elastin stimulation, and of course hydration effect. So we did this step from excellence to the perfection. So we should expect something from these threads. We are using this product and these methods almost 2 years. Maybe for those who came to my clinic, to our clinic in Georgia, they have seen that we are not using the products with a nice packing. For those who has been in my operation room, you have seen that we are using something else, not the same like you are using in your practice. That is that threads. We are using them for almost 2 years on our patients, and more than 100 patients underwent this procedure. And we see that we are getting not only immediate lifting effect like we have it from Excellence Visage, but also we see immediate rejuvenation effect from hyaluronic acid itself and reduction of the time of rehabilitation. To prove that, we decided to do a histological research. And we compared polylactic and caprolactone thread, which we have a composition for our threads, with a thread with hyaluronic acid. It was peak, and we took different time, 14, 30, 16, 19 days after of histology. So what we see on this histology and on this research? First of all, macroscopically, we see that connective tissue has more stable time during this period, 14, 90 days. And it is thinner than in case with the thread without hyaluronic acid. Reaction around the thread with the hyaluronic acid, less and very short. It means that we are reducing collagenesis around the thread. We are reducing thickness of the connective tissue. And we are reducing, of course, time of rehabilitation and possible complications like inflammatory reaction after the thread lifting. This is the first thing. We see another, elastin. The growth of elastin around the thread with the hyaluronic acid starting practically immediately after thread insertion. It is much more in quantity than just with the thread without hyaluronic acid. And it is shown here and also on histological research, as you can see. So it means that our skin of our patient will have much more elasticity and will look much more younger after using such thread for their face. And which is also important, collagen, first and second type. We also increase quantity of the first and second type of collagen while introducing such thread under the skin. But look on it, how it looks like. First period, first days, before 19 days, here you see that collagen working from hyaluronic acid. Then hyaluronic acid absorbs and thread, polylactic and caprolactone, makes the same work after. We have seen on our patient while using usual Visage that after 2-3 months they look younger. The structure of their skin are better, younger, smoother. Not only effect of lifting we are getting from Visage, but it was after 3 months. Today we have the same effect immediately because we have hyaluronic acid included to our threads. So it means that this thread not only safe, but also makes more rejuvenation effect immediately after introducing it to our patients. And we prove it on our practice with our patients. For example, this ultrasound research shows us the difference between skin, dermis, and soft tissue during first 6 months. After 6 months of introducing and insertion of threads with hyaluronic acid. It is much better, stronger, and younger on the left slide. So, to summarize all this research, we can say that threads are much better with the hyaluronic acid included. The thickness of the capsula is much less, and inflammation around the thread much less during first period when we insert inner body inside of soft tissue. It means that we are reducing time of rehabilitation and we are reducing a possibility of complication like inflammation for the inner body. We have more elastin production in soft tissues. That means that our skin, patient skin, will be much more elastic and younger. And collagen, first and second type, starting to produce immediately after insertion of this thread, and later when hyaluronic acid absorbs polylactic and caprolactone starting working and make the same work for them. Returning time back, we are looking to the future. This is what we think. Thank you, colleagues. I hope this product and this method will be really interesting for my colleagues all over the world. Today we will follow our session, and just in few minutes, my brother Konstantin, directly from Tbilisi, from our clinic, will use these threads for his patient. This will be the first live show, and you are invited. We have a second room. We are finishing this room now, and we have a second room right here, and we will follow full day with the different discussions and different presentations of our colleague. We have a satellite, but we will start with a live demo of my brother. So I welcome you and invite you there. We can follow together to another room. Thank you.